Welcome to another Health Announcement Spotlight. I'm Jody Tropiano Green, the head of content for health, and I'm joined today by Dr. Marla Dubinsky, the co-founder of Trellus Health. Marla, thanks so much for joining us today.
Thank you for the opportunity.
So first off, can you just tell us a bit about Trellus Health?
Sure. So Trellus, we're a healthcare company that is offering a validated tech-enhanced personalized self-management solution called Trellus Elevate that was really designed to build an individual's resilience, improve health outcomes, and reduce the total cost to manage complex chronic conditions.
And so digging in on that a little bit more, can you tell us how the Trellus Elevate solution is addressing the rising cost of chronic conditions?
Sure thing. So we have a holistic model that addresses both the physical and the emotional aspects of chronic condition management, and really with the focus of closing that gap between what is necessary and unnecessary healthcare spending. We deliver measurable results that enhance, not only the well-being of the individual, but really encourage the appropriate treatment and medication adherence, which we believe really results in reducing costly healthcare utilization, ultimately providing value for health plans, employers, providers, health systems, and the pharmaceutical sector.
Right. And which chronic condition did you first validate Trellus Elevate with?
Sure. So I'm a gastroenterologist here actually in New York at Mount Sinai, and I'm the director of the Inflammatory Bowel Disease Center, what we call IBD. And we originally validated our method in individuals living with IBD, which encompasses two diseases. One is called Crohn's disease, and the other one is called ulcerative colitis. And it is one of the costliest and most debilitating chronic conditions that affects approximately 3 million Americans and rising. And like other high-cost claimant conditions, as noted, it was on the rise. And in our published validation study, we demonstrated that individuals with IBD who had a low resilience score showed significant improvements when they were enrolled in our resilience building program at Mount Sinai. Not only did their resilience scores increase substantially, but they also experienced a greater than 90% reduction in hospitalizations in the year following or during that year after they enrolled in the program, and also had a reduction of over 70% in ED visits, similarly for those that were in the program. Interestingly, when we had our control group, which were individuals who had low resilience, but did not enroll in the program, we actually did not see a decrease in healthcare utilization, and we actually saw a modest increase.
That's incredible. Congratulations on that.
Thank you.
And so I guess taking it back a bit, what was the impetus for starting Trellus Health to begin with?
So me and my co-founder, Dr. Lori Kiefer, who is really one of the world's leading clinical health psychologists in resiliency, particularly as it relates to chronic condition management, we felt that working together at Mount Sinai, if we combine the medical, emotional, and behavioral management yielded such incredible results and consistent results, we wanted to scale that, particularly the behavioral aspect of our care, beyond the four walls of Mount Sinai, so more individuals with other chronic conditions could benefit.
It's extremely important. And so what's unique about the Trellus Elevate approach?
So Trellus Elevate begins with a proprietary assessment where we measure and assess and identify the attitudes, beliefs, and behaviors around their condition, their medication, and their overall quality of life. Prospective members then meet with our resilience expert navigator to confirm and contextualize the results of these assessments, ensuring the suitability for the curriculum, because not everybody may be ready to be resilient or understanding that they're at a point in their disease state or their condition management that they need this wraparound support. So then we tailor a program that's combined with between human touch points and remote monitoring, adapting to really the individual's evolving needs so that we improve the symptom management and quality of life of these individuals. Our specialists oversee the curriculum on the back end, actually. So we've got, experts who oversee the curriculum. They track member progress and enhance the program engagement, because we know that it's difficult when you have a lot to do on your plate. Take daily medications or weekly injections or monthly infusions. There's so much to do. And so what we do is we reassess the individual's self-efficacy, their ability and confidence in managing their disease, and remeasure their resilience as an interim metric. So we know we're on the right path, and we have to adapt in real time if sort of there's a change in their attitude or the behaviors. And we also repeat our assessments at the completion of their curriculum. And really, the program is tailored to the individual's needs, and the individual determines the pace that works for them, because not everybody learns in the same way or progresses through some of these curriculums at the same rate.
And so, big final question, why should others partner with Trellus Health?
So, we offer our partners, dissecting it out, what are the key elements that I think is really going to change the landscape of how we all deliver care, all stakeholders, with the patient in the middle. We have a proprietary approach that's backed and by validated results based on deep clinical and resilient psychology expertise. We started with IBD, which is one of the top high-cost claimant conditions, and our proprietary person-centric method is adaptable across multiple conditions and outcomes. It's not just intended for IBD. We offer a customized, flexible approach to education and training, ensuring personalized support for our members through our in-house learning management system. And also, our technical architecture was designed for flexibility and scalability to meet the evolving needs of both our clients and our members.
Amazing. Well, I do have friends and family who do suffer from IBD, so really applaud the work that you're doing. And thank you so much, Marla, for being with us today.